Welcome to Pathology Navigator. Today's topic: asbestosis. Epidemiology. Asbestosis is a type of pneumoconiosis. It is an occupational lung disorder. There is increased risk in people working at construction sites or shipping. It mainly affects lower lobe of lung. Asbestos fibers are mainly of two types: serpentine fibers and amphibole fibers. Serpentine fibers are curly, flexible fibers and hence easily degradable. Amphibole fibers are firm, rigid fibers and hence not easily degradable, therefore more pathogenic. In this image you can see two types of asbestos fibers. On the left are curly and flexible serpentine fibers which are not much pathogenic. On the right are straight and hard amphibole fibers which are more pathogenic. Diseases caused by these fibers. Pleural plaque, most common and earliest manifestation. Pleural effusion. Lung cancer, most common is adenocarcinoma of lung. Malignant mesothelioma, it is most specific of asbestosis. Microscopic findings. Asbestos bodies. Ferruginous bodies. They appear as dumbbell shape under microscope. Asbestos bodies are composed of asbestos fibers, and can be seen in the image as shown. Ferruginous bodies are asbestos bodies coated with iron, thus Prussian blue positive, and can be seen in image.